When Jane, not her real name, was diagnosed with breast cancer 5 years ago, she was sure the disease was fatal. But a cancer diagnosis is not the only burden she's been carrying. The other, she says, is a lack of acceptance from many in her community.
In this our society, especially in Nigeria, when they see somebody with cancer, they think maybe you are cursed, or maybe you are so unlucky to have cancer. Not knowing that cancer can happen to anybody.
It is this stigma associated with cancer patients like Jane that has prompted an online campaign by members of Stand Up to Cancer Nigeria with the purpose of confronting misinformation about the disease and to encourage those with worrying symptoms to seek professional advice and screening, a key part of early detection.
And we see people engaging, we put up things on Instagram and people are engaging, telling us, like we're in a mini consultation when they send us private message, like mini consultation, like from all over the country. Find people from the east, the west, the north, even people from the north, sending message, trying to know, okay, where do I go to? I have this challenge, I'm scared I have cancer, And this is the banner for World Cancer Day in Nigeria. So this is in Nigerians, owning the awareness campaign, of cancer in Nigeria. It's not something that's, given to us. This is ours, So this is the page. So anyone that wants to support the fight or support the awareness, goes here and clicks the login.
Stand Up to Cancer Nigeria has registered nearly 200,000 active users from all over the country, acting as an online support group. Now they hope that the current anti-stigma campaign will continue to challenge myths deeply entrenched in the culture. Patients like Jane say the stigma is also prevalent among healthcare providers. When patients try to access treatment, some caregivers reluctantly respond with a belief that cancer is a death sentence, and therefore more must be done to educate them.
I noticed lump in my breast. Then I went to the hospital.
Jane will need further treatment to clear a tumor that has been recently discovered in her left breast. But she remains determined to focus on recovery, even if that's a long road ahead. Sophia Dengo, CGTN, Abuja, Nigeria.